So we're gonna do this in two parts a little. We want to have a panel that's going to talk about what's happening programmatically in Washington, and then we're going to have some time for Annett Bovent, who is sitting right here next to me, to talk about her own personal experience. So when we're going through the panel, and it seems like Annett's just sitting quietly, we're saving the best for last. So I want to kick off the panel with Antony Chiang, who is all the way over there. Who is at Empire Health Foundation. Hi, Antony. Thanks for being here.
Great to be here, Sam.
Antony and I have gotten to know each other through work on the ACES Public-Private Initiative, or APPI as we call it, and also through Essentials for Childhood, which is another statewide group looking at ACEs. Will you talk a little about both Empire Health Foundation and those two initiatives and what's happening sort of in a larger statewide context?
Yeah, absolutely. Thank you very much, Sam. And people ask me all the time, what is a health foundation doing working in foster care or working in terms of trying to prevent child abuse and some of these other things, when shouldn't we be working with the pipeline of primary care physicians and those kinds of things? But as Nadine just told you, I mean, to have a 2.5 times chance to have cardiac disease, to have a 26 times chance for a diagnosable mental health condition. It's pretty obvious that if we want to get upstream from our healthcare system, it's absolutely critical that we prevent and mitigate ACEs. And so Empire Health Foundation has been involved in a number of statewide initiatives, as Sam just mentioned. The ACEs Public-Private Initiative has been about I call it the Reese's peanut butter cup, the magic combination of community capacity building, which I think you'll hear about more from Geof up here on the panel, along with the ACEs and the science behind the ACEs research, to say, how can those two things work together to really increase the mitigation and prevention of ACEs. And then Sam and I also serve together on Essentials for Childhood, which is a new statewide initiative that's sponsored by grant funds from the CDC, and again is really about a collective impact mission to really galvanize multiple sectors, cross sectors, to work on ACEs in our communities, both at the state level and at our regional level as well. And I'll mention actually a third one that's part of the fabric of statewide initiatives, and that's the Frontiers of Innovation work that's been catalyzed by Dr. Jack Shonkoff at the Center for the Developing Child at Harvard. And so we don't have just one or two, but we actually have three, and in fact there's a whole bunch of other flavors that I could mention, but I'll stop at three. But we just have this incredible fabric of initiatives that is a tapestry in Washington State, all really catalyzed around the ACEs research as a foundation.
Excellent, thank you very much. You mentioned Geof. We'll turn to Geof now. Geof and I met in our doctoral program. He finished. Just saying.
I believe in you, Sam.
Yeah, thank you. Someday. Geof's the executive director of Whatcom Family and Community Network, and they are doing a lot of training and community conversations about brain science and resilience and ACEs, and I would love to hear you talk a little about how that's changed your conversation in Bellingham.
So about 9 years ago, we started doing some training on this and beginning the conversation. I think our theory of change around this, as an organization, we mostly focus on community capacity building and community organizing. And so our thought was, we start with raising awareness. People need to have a conversation. It was bringing different people to the table who didn't think they were connected, as Antony said about different foundations. We found that different practitioners said, wait a minute, we're all working with the same families. This is more than just child abuse and neglect. It's about the trauma that kids face and toxic stress that comes from many things. And the dose response told us a lot. So there was a lot of information. It led us to again, hosting conversations about that kind of went from increasing awareness to how to change thinking fundamentally about what we were doing. Then we could lead to changing practice, because the practice was going to have to emerge out of the new thinking. Because with the same thinking, you're going to you're not going to get a different outcome. And so we looked at long term, if we didn't change the thinking, we couldn't change practice, we would get a different outcome, because what we do now is getting the outcomes we get now. And so that process has really brought a lot of people to the table. We've gone as far as the county council has adopted a resolution that put trauma-informed thinking into county funding practice. The Community Health Improvement Plan has included adverse childhood experience and resilience and neighborhood connections into it. Many schools are doing lots of incredible work using the data to say, how do we change how we do things, which is, we've reduced, in one of the schools, reduced out-of-school suspensions by 95%, and the principal said to me, boy, are the teachers tired. So self-care has become really critical in the work so that they can really actually support the kids who now are in the place they should be. So that's...
Great. Thank you so much. All right, so this, the idea for this program today really started on work that was happening inside Thrive by our own Quen Zorrah, who I am thrilled to have up here today. So Quen is a member of our home visiting team. She's our state lead for the Nurse Family Partnership Program and is a nurse and came to us from the public health system on the peninsula. So she's been working on what we call Near at Home, which is a toolkit for providers to think about how to infuse ACEs into home visiting. It was released in March on our website, and people all over the world have downloaded it. More than 600 downloads have happened, and really we make them give us their zip code. So like within the first week, somebody had to contact us and say, we don't have a zip code in the UK, what do I put in there? So it's been really exciting to see it happen. So I wonder if you can tell us a little, it's called Near at Home. Tell us a little about what near means and why home visiting is such a good place to incorporate ACEs.
Great. Well, there was a group of us home visitors who were working on this project to capture the wisdom that we had developed over years of home visiting and talking about many difficult, sensitive subjects, including ACEs. So we wanted to write this down. But as we were talking about it, the home visitors said, but we do so much more than ACEs. And we were struggling with that language. And about the same time, our partners at Foundation for Healthy Generation coined this new acronym, NEAR, and it immediately resonated with home visiting. So we picked that up as our own and call our toolkit Near at Home. So NEAR stands for neuroscience, epigenetics, ACEs, and resilience. Because when we go talk to families, we don't just talk about the difficult things, the trauma, we share some of the science about brains, why it's so important, and we always lead with resilience and strengths and hope. And home visiting, I think, is at a critical place in this whole conversation. I think that home visiting is ACEs prevention for babies and young children. Because in home visiting, we start very early in a child's life, often in pregnancy, before ACEs have set in. But certainly in the first couple years when brains are forming and parenting patterns are forming, one of the beautiful things about home visiting is that we work with two generations. We support the parents to develop skills, understand their child's development, et cetera, and we work to support the baby. So we're able in one program to support two generations. But I want to echo what other speakers have said, that we have a major challenge in Washington State, that we're only reaching a fraction of the families that deserve home visiting, because our Washington State data is showing that as a population, our high school kids are carrying a larger burden of ACEs than our adults. So clearly we need to expand home visiting so that every family who wants home visiting can receive the support they deserve.
All right, thank you. Okay, so I want to return to Geof. I learned about the work that you were doing around ACEs through APPE, actually, through the research that we did as part of APPE. And I wonder if you can talk about what it's been like to try to figure out how to evaluate this work.
It's been challenging. I think some because we look at this, usually we measure what we don't want. We'd like less child abuse and neglect. We'd like less dropping out of school. And so all of the markers we have are of what we don't want. They're of the adversity, and we're not measuring what we do want. And we all know that what you measure is what you see more of, what you pay your attention to. And so some of this we've noticed that some of the conversations we've had have been about what's not going well. I don't know how many of you need grant funding for what you do, but you tell a bad story and you get more money. You tell a good story and so we've kind of learned to say, oh, no, it's really terrible here. So it reminds me of a conversation I had with a woman on the Lummi Reservation who said, our story isn't one of adversity. It's one of resilience. We are an incredibly resilient people. We have survived when you didn't want us. and that's the story we don't tell ourselves about who we are a lot. What we tell the story is how hard it is for us. And we come to believe that. So in some ways, for communities, what we've noticed is that the challenge in this is, are we measuring the things that we want to see more of? Or are we measuring the things we want to see less of? And we've, as a community, have said, we're going in the wrong direction if we're only measuring some of the things we don't want. So anyway, that's something the conversation's really shifting to. What are the 10 things we want to see a lot of? Let's focus on measuring those.
Excellent, thank you. So Antony, you and I sit in rooms with a lot of people and eat sandwiches.
And they're delicious sandwiches.
And they're delicious sandwiches. Thank you to the state agencies who provide us sandwiches. Can you talk a little about the challenge of being in those rooms and actually building a statewide movement?
Yeah, absolutely. Your question reminds me of the very first time I started to learn about the ACEs work and the ACEs science, and we went to one of what I call the bright spots, right? For every 100 communities, there might be 99 who are still struggling with how to lower and mitigate ACEs, and then there's the one who's actually making a difference. And so we went down to see Jeff's counterpart, Terry Barilla, in Walla Walla, where he mentioned the school that had, Lincoln High School, that had reduced out-of-school suspensions by 95%. They actually also reduced police reportable incidents by 75% in the first year and increased the graduation rate of their alternative high school from 7 a year to 50. And so I had to see this for my eyes in person. And as we were going around that high school, I met a social science teacher who was like, yeah, there's one of the kids last year. He was missing from my classroom about 60% of the time last year. Why don't you go talk to him? And so I went and talked to him. I said, hey, I understand you were out of school a lot last year, and how about this year? How's it going? And he said, 100%. And I said, really? Same teacher? Yeah, same teacher, same principal, same staff. Yeah. I said, what was the difference? And he said, I feel safer in school this year than out of school. And the big difference was the school had done ACEs training so that teachers, when he dropped the F-bomb in the classroom, instead of saying, hey, young man, don't be disrespecting me, get the heck out of my classroom and go to the principal's office, the staff was trained instead to say, what happened last night? And it was much more complex and multi-pronged than what I just shared, but that's the essence of the story of the change. And I think the biggest challenge, to answer your question, Sam, is how do you take these bright spots, like the Walla Wallas, like the Whatcom counties, and you'll hear Annett's story a little bit later here, just this afternoon, and scale that up, community by community, county by county, until across the state, we have those kind of results where there's 95% reduction in out-of-school suspensions across the whole state, where we've been looking at a bright spot with a multi-pronged strategy in Medford, Oregon, where they reduced the number of kids in foster care by 50% in 5 years. And there's many other bright spots like that, where you can actually get upstream and reduce and prevent ACEs. And I think that fundamentally, we can have lots of these great lunches where you've got the secretaries of health and the director of early learning and a room full of CEOs, and the same thing at the community level with these networks. And yet, how do you bridge the gap between this incredible science of ACEs with the practice and the best practices and the systems change necessary to really help and improve the lives of kids and families in our communities.
Thank you very much. So, Quen, I've heard you say something in a speech recently, maybe at our board meeting, where you used the term, ACEs are about understanding experiences, not creating excuses. So can you talk a little about, when we talk about ACEs, how do we do so without creating a sense of victimhood?
I would say just the opposite is true, that when people, and I work primarily with parents, learn about the ACEs science, learn about neuroscience, they don't feel like a victim, they feel empowered. It's for many an aha moment, like, oh, that's what's going on. People have said to me when I've done their ACEs questionnaire, oh, I thought it was just me. I thought I was the loser. I didn't think I was human. So people, especially parents, are motivated to move forward in life, to make changes. And in home visiting, we are in an ideal situation because we can explore these difficult topics like ACEs, but then focus on building the resilience by building the skills and knowledge so that parents can be the type of parent they really want to be. We all learn how to parent by how we were parented. So for our parents who are carrying a heavy ACEs burden, they deserve the support of home visiting, informed pediatricians, and an informed system so they get that support wherever they go so that we reduce this intergenerational burden.
Excellent. So that is a great transition to our fourth panelist, Annett. So Annett is from Walla Walla, and Antony was mentioning the great work that's happening there, and Annett has been involved in that work as a person. So your story about ACEs is really, well, I mean, you are one. Let's just both admit it. Yeah.
As opposed to
I know,
Sam.
parent representative, but, you know, parents are people, Annett. Your story about ACEs is really powerful, and we wanted to give you the last word because of that. I think when we originally envisioned this panel, you would just be a part of it. But it seems like we really need to call this out and give you the rest of the time today. So I'll turn it over to you.
Thank you for letting me come and share my story. I have all 10 ACEs, and I lived in a very bad situation. My house burnt down when I was 7 years old. I was the one that woke up, and there was 5 kids in the burning house. And I was able to get all of us out safe, and we were under the age of 9. My mother, when I was 10, broke my stepdad's belt in half over my body. I was bleeding from my head to my toes, and it took my body 3 months to heal. And at that time, she took me out of school, so I wasn't acknowledged. You know, I wasn't seen at school, so we had moved 23 times in my lifetime, so there was no stability, no couldn't have friends or anything like that, no social life. 7 times in 1 year that we had moved. And I was also homeless 3 times in 12 years as a single parent of 3. When I was 13 years old, my grandmother passed away in front of me. I was the only one there. Once again, my mother pulled me out of school. I lived in Sunnyside at the time, and then she took me to Milton Freewater, where my grandparents were from, and dropped me off. And as the end result, the doctor said that I didn't tell him the right side of the street that she lived on because she had moved from her home that I knew of since Grandpa had passed away a year before. So, and I have never shared my grandmother's last words to anybody. The neglect piece was there was never enough food in the house. I can recall standing at the garbage cans in the lunchroom in junior high, and I would ask people for something off of their tray before they threw it in the garbage, and some people would give it to me, and others would laugh at me as they dumped their tray. And my biggest fear in the world still is to go to the grocery store and the shelves would be bare. So I moved to Walla Walla 16 years ago as a single parent with a 12-year-old, a 13-year-old, and a 3-year-old. And I didn't know that this is what was happening, but I realized that I was building my village. So I moved from a positive perspective in life by building my village, which means that I got rid of all the negative in my life, including my own family members. Everybody in my family either is an alcoholic or has taken drugs in the past or still do, or just very negative people. So I have actually walked away from my entire family, but I started building my village, and just a few people in my village would be my pastor at church. Terry Barilla is a good contact person that has believed in me since the day one. 2 people or 3 different people, I guess, from school professionals. The special ed director at the school district, and I guess Grandma Katie was Terry's mom, and I used to get to take care of Katie, and she filled that gap in my life that from losing Grandma that was there. So some people in my life, the one that is crossed out, I wanted to share that because some people in your life aren't there permanently, and new people come in, and she's actually the only person that I was able to cross off in my village. And since I drew the posters and stuff, a lot more people have been added to my village. So because I grew my village, I love the saying that it takes a village to raise a child. So once my village all came together, a lot of positive things started happening in my life. And to make a long story short, I received a interest-free loan on a home, a brand new home from Hayden Homes. There was like a lottery drawing in Walla Walla, and I was selected for that home. And through receiving that home, I know that I am home now. I can trust people in the community. I know that I have stability in my life. I don't have to get up and move every year. I have hope for the future, the security and love. And on March 23rd, I actually celebrated my 6-year anniversary in my new home. I'd like to share with you that because of the positive people in my life and the influences that I've had, in December of 2013, I started my own organization, and it's called Hope Heals. And I provide care packages with all of the necessities, dishes, silverware, bath towels, laundry soap, dish soap, a laundry basket, mop, broom, dustpan, all the necessities that you would need in order to move into your new home. And these go to homeless vets transitioning into permanent housing, and also homeless families transitioning from the homeless shelter into. Thank you. So the life that I was living before, I lived in poverty. I was alone. I trusted nobody. I was a victim of my mother's abuse. I didn't have choices. I was ashamed. I lived in dysfunction, and I was trapped by the world. And after my village came together, I know that dreams come true. I've been accepted into my community. I believe in myself. I am much stronger than what I've ever been in my life. I am now connected into the community with a lot of things. I am hopeful for my future. I can trust people now. And I'm courageous by sharing my story. This is actually my 58th time sharing, and I have gained freedom from my mother's abuse.
Thank you so much. Thank you. And thank you to all of you. Antony, I can't believe you didn't make me cry. So I want to just wrap this up by saying this is such important work. And we really, I think, all have a responsibility in how we approach our work to ensure the dignity and the joy and the resilience of the people that we work with. And it's really the place from which we at Thrive are trying to work, and it's really in our partnerships. So much of what we see, so much of the great work that's happening in our state is really about lifting up amazing people who are struggling in their lives and giving them hope for the future in the way that Annett has experienced. And we really thank you all for your partnership in that work with us. Thanks very much, everyone.